Hello, my name's Jules, and this is The Secret Mind. Welcome back. Today I'm going to do another episode of my police memoir. I used to be a police doctor, working in the north of England, visiting the police cells and the people who had just been arrested. A common occurrence would be, what are you going to do when they need to get their hands on their drugs, their opiates in particular, and they're not going to have access to their suppliers other than, oh, I don't know, maybe a police doctor. So, unpunished. The next episode. We have a tendency to prescribe a combination of dihydrocodone and diazepam for those withdrawing from heroin, those who missed their methadone, those who are prescribed methadone but top up with heroin, and sometimes those who miss their Subutex, buprenorphine, or pretty much any other opiate when the patient needs something. If the detainees stay long enough for a review, they may well bid for a higher dose. Some cases are entirely justified. One size does not fit all. And these are people who can take an incredible amount of opiates on a daily basis. Usually people are experienced enough to get their orders in soon after arrival in custody. They know what our standard regime is, and they know our standard doses. They're even able to predict the effect. It doesn't touch the sides. I explain to them that our plan is not to duplicate the amount of drugs that they have been pouring into themselves. The full tally is often a combination of a well-meaning medical prescription, but that plus the top-ups they buy with their disposable income, or somebody else's disposable income. These recreational habits often go by the name of self-medication, a word that wallows in its own irony. Hell, plenty of soft-touch mental health workers unhelpfully refer to it in the same way and litter the medical notes with the terminology. Patients may repeat the phrase back to you, but drug misuse is not the same as self-medication. It's an excuse that installs drug abuse heavily within our culture and normalizes self-destructive behavior. It matters what you call things. New from the good people who brought you retail therapy comes self-medication, now available in alcohol or nicotine or crack. A term such as self-medication gifts pseudo-validity. When it's endorsed by healthcare professionals, that validity creates harm. These patients are not easy to deal with. We don't bring them all back alive. It may take a little extra effort to bring about some strategic change, but that's not their fault. Getting a connection with them takes that extra moment. Patients are suspicious. They may be highly experienced users of the drug and alcohol services and not used to innovative approaches. The dynamic takes a moment longer to install because they don't expect to get more help at a police station than they do at the local substance misuse service. But the consequence that when you start engaging with this problem, you know you cannot rely on the hundreds of people who work at that local service to continue and connect your efforts. That doesn't mean it's not worth doing. They see their methadone as offering the answers. So I started asking every patient what actual therapeutic treatment they got when they picked up their methadone. It was patently obvious to me, and I presumed to them, that the best thing the daily methadone program had going for it was an unbeatable opportunity to make clinical contact. Normally, mental health services pretend they're disappointed that patients don't turn up for appointments, but every day these particular subjects are a bunch of people whose singular highlight of the day is to turn up and to collect methadone. This attendance is a gold-plated gift that can then be leveraged for strategic planning. It isn't only methadone that they were getting. It must be methadone and strategic suggestions. Methadone and a fillip. Methadone and a revised plan. Methadone and support. I asked everybody. The answer was always the same. Nobody was bothering. When you are the ones with the resources and opportunity and you don't use them in an adequately human way, the only thing that remains is the harm. And methadone offers that in spades. There is a motto in medicine, primum non nocere. First, do no harm. But do harm alone. And you and I are just not going to get on. See you tomorrow.